Coming up on the Sarc Fighter podcast.
And I think that people assume that Black women are strong. Women of minority descent are strong because of how we were treated in early ages and everything like that. So we took on the strength of our ancestors, and that we can handle a whole lot more than anybody from any other demographic. That's not necessarily true.
African American women are 13 times more likely to die from sarcoidosis than whites.
Because, African Americans are, at higher risk for other illnesses as well. It could be an economic status. It could be environmental status. It could be anything. But it's just one of those things that you're kind of baffled about.
Coming up, a look at how the Foundation for Sarcoidosis Research is helping them find their voice, with hopes the medical community will listen.
This is the Sarc Fighter podcast, living with sarcoidosis and other rare diseases. Here's your host, John Carlin.
Hello and welcome. This is episode 47 of the Sarc Fighter podcast. I am your host, John Carlin, a fellow Sarc Fighter. This podcast is brought to you in part by a grant from Atyre Pharma. So I do this podcast, as you've heard me say, to offer my fellow Sarc Fighters hope and to help you connect with other Sarc patients, to hear their stories, understand how sarcoidosis affects their lives, and hopefully that helps you understand what you are up against and what you need to do to overcome, whether it's the disease or the effects of the medicine or both. And at the end of the day, I try to offer hope, because a lot of people are finding a way to either cope or overcome their situation, and it results oftentimes in a situation where people have found a way to deal with sarcoidosis. But today we're going to talk about the group who is fighting harder and dealing with more and sometimes not having such successful outcomes, and that would be women of color. It's a sobering topic. I'll tell you that I think it ends with hope because somebody's doing something about it, but we've got to look at some tough facts first before we get there. African American women, or women of color, are in a tough spot. They are by far the largest group of people to get sarcoidosis, and their cases tend to be more extreme. In fact, they're more likely to die from sarcoidosis than any other group, even more than African American men. And there are statistics that bear that out, and we'll get to those a little bit later on in the podcast. But trust me, when you hear these things, it's just amazing how much worse things are for this group. But then a couple of questions come to mind, because the first thing you want to say is, well, why? Right? I mean, why? So are they just more susceptible to sarcoidosis? Do their bodies just get it more easily? Is there something in their DNA, their genetic code, that opens them up to sarcoidosis? Or perhaps, is it the fault of doctors in the medical community? Are doctors just not listening to their patients? Are they disregarding them? Do they see them as unimportant? Is there something that happens when a woman of color shows up and says, "Hey, I don't feel good," and the doctors just blow them off, or don't look deeply enough into the situation, and then the sarcoidosis takes over and it's too late? Is that a part of the problem? And I can tell you that to a certain extent it is, and we're going to delve into that today. But also, is this group just socioeconomically less able to access quality health care? A woman of color starts feeling sick, but she either doesn't have insurance, or she doesn't have a car to get to the doctor, or she has a car but she's got small children, she doesn't have daycare, she can't afford daycare, or she's dependent upon a friend or a relative to take her, and so she winds up either not going to the doctor or not following up with her appointments. And so there's just a socioeconomic component to this that can also lead to a situation. And then you look at all of these different things, and do they compound themselves? And do we wind up with a lot of people having extremely severe, to the point of mortality, cases of sarcoidosis that just shouldn't be there? So in order to answer those questions and to do something about it, FSR has created the Women of Color Patient Advisory Committee. It's 15 African American women. They range in age from 33 to 72 across 10 different states with 11 different kinds of sarcoidosis or manifestations, if you will, to use a slightly more medical term. And so these women will be engaging in media interviews. They'll be sharing their stories. They'll be out there in the public trying to empower others and to draw attention to this situation. And I got to tell you, I'm pleased to say that some of these women have appeared as guests here on the Sarc Fighter podcast, or I've met several of them through the different committees at FSR that we both serve on. And I want to read you the names of the women who are on this committee, because I think that they deserve that. They deserve to get a shout out because they're putting themselves out there. So here they are. The 2021 Women of Color Patient Committee members are Cheryl Bradford, Erica Courtney Mann, Gary Farrow, Jeanette Harper, Brenda Harris, Marcia Henderson, Gloria McDaniel, Mary Oldham, Chasta Posey, who will be joining us here on the podcast today, Jessica Props, Jessica Reed, Aura Riley, C. Ann Scott, Rhonda Underhill, and Catherine Washington. So congratulations to all of you for having the courage to step up and to share your stories and to help shine a light on this problem with women of color when it comes to sarcoidosis. Now, there's also, I just want to point out, there's a distinguished group of doctors who are working on this as well. So they would be the Clinical Advisory Committee, and they are working with the WOC group, and that includes 4 clinicians and an epidemiologist. And we'll be hearing from one of those doctors, Dr. Ennis James, also in the podcast today. So getting back to those questions. Whose fault is it? Is it anyone's fault? And no matter what can be done to fix the problem? So joining me again today will be the Women of Color Committee member, Chasta Posey, who is a dynamo in the fight against sarcoidosis and one of the very first people I interviewed when I started this podcast. And I've met Chasta in person, and we've been involved in several calls together, Zoom calls during the epidemic. And so she will be joining. And then Dr. Ennis James, a physician specializing in sarcoidosis and Sarc research from the Medical University of South Carolina. And he is working very hard on solving this problem for women of color. And I also learned during the interview that he turns out to be Chasta's doctor. So kind of interesting to have a patient and a doctor on at the same time. But although we didn't delve too much more into Chasta's story, but I can tell you that she's lost the vision in one eye, and she has sarcoidosis in just about every part of her body. And I'll put a link to the original interview with Chasta in the show notes. So we didn't go too much into Chasta's situation other than to talk broadly about this women of color situation. But I'm going to ask both of them why sarcoidosis is so much more prevalent and dangerous in women of color, and they have some interesting answers as to who is to blame and what the reasons are. So the topic of women in color and sarcoidosis next on the Sarc Fighter podcast.
I feel like a zombie, just feeding and stumbling.
Hi, I hope you're enjoying the Sarc Fighter podcast. You may be wondering, what can I do to help? How can I be a part of the sarcoidosis solution? It's simple. Make a donation to KISS, Kick In to Stop Sarcoidosis. 100% of the money goes to the Foundation for Sarcoidosis Research. Look for a link in the show notes of the Sarc Fighter podcast. Welcome back to the Sarc Fighter podcast. And joining me now is Chasta Posey, who works with the Foundation for Sarcoidosis Research as an advocate, a peer mentor, a patient navigator. She's one of the original, it used to be called ambassadors, but now it's advocate, which I am also. So I met Chasta at a meeting that we had before the pandemic shut everything down, and she's been on the podcast before, but now she's here in her capacity of the Women of Color Committee. Chasta, welcome. Thank
you. It's so good to see you and to have me back.
Yeah, so good to have you back. And now this Women of Color Committee is shining a light on something that's really important, because African American women, and we're going to go over these statistics, suffer from sarcoidosis just way more than any other group. Tell me about that right off the top.
Well, in the origination of sarcoidosis, and when you research it and you look at everything that it entails, women of color, women of Scandinavian descent are highly more affected with sarcoidosis than any other demographic known. And a lot of us don't really talk about it a lot because of some of the disparities that African American women have in the healthcare field and everything like that. So I think the Women of Color Committee is very vital to sarcoidosis in African American women and getting research and developments done and everything like that. So I'm excited for what we're doing, and I'm excited for what's to come.
Yeah, so let's jump into this whole disparities thing, because there are 15 women on this committee, mm-hmm. African American women, and I have met many of them through different committees and so forth with the foundation, and also through the podcast. But you said that when you guys sat down and you started talking, and you already used the word disparities, you are seeing a pattern develop here. What is that pattern?
The pattern that we're seeing develop is that women of color, not just African American descent, but any woman of color who is considered in the minority, they are looked down upon in the healthcare field. A lot of doctors and healthcare providers don't really pay a lot of attention to the problems and the issues that African American women have. We can probably say what we think it is, but one of the things that I thought about growing up is that I saw a lot of strong women around me. And I think that people assume that Black women are strong, women of minority descent are strong because of how we were treated in early ages and everything like that. So we took on the strength of our ancestors, and that we can handle a whole lot more than anybody from any other demographic. That's not necessarily true. We hurt just like everybody else hurts. We go through just like anybody else goes through. And I think sometimes we put the stigma of strength on us as a replacement for what we really need. And we can be strong all day long. And I see a lot of people posting, and even myself, take on the mantra of, I have no choice but to be strong, because being strong is the only other option that I have. No, you have plenty of options. You have plenty of options. And one of those options is the healthcare that you pay for, that comes out of your check, that you pay those taxes for. The healthcare that you pay for, you're due and deserve that same equal amount of attention that anybody else gets. So women of color, we're treated differently. Women of minority stature we're treated differently, and we're just trying to close that gap and bridge that gap between the patient and the provider.
And we'll talk a little bit more about what the foundation is doing, but basically, you guys are launching a month-long social media campaign. That'll be coming up during Black History Month in February of 2022. And there's a whole lot going on. And I also want to mention right off the top, let's see, there will be a Twitter chat sponsored by Mallinckrodt and Global Genes, and that's coming up on Monday, October 25th from 11 a.m. to 12 p.m. Central Standard Time. and some of the doctors will be on there to answer questions about sarcoidosis and so forth. So I want to commend you and your group and the foundation for taking the bull by the horns here and saying, look, there's a thing out there and we need to address it. And I'm going to share a couple of statistics. This is from the news release that came out yesterday from the foundation, really announcing this group. African American women are 3 times more likely to develop sarcoidosis when compared to Caucasians. They are also more likely to experience chronic and severe symptoms, leading to hospitalization rates 18 times higher than Caucasian men, 10 times higher than Caucasian women, and more than double that of African American men. And then it says, additionally, sarcoidosis-related mortality rate, people dying from sarcoidosis, this is tragic, Shasta, 13 times higher than that of Caucasians and 1.5 times higher than African American men. Is that because you're mistreated, or do your bodies have a stronger reaction to sarcoidosis, or both?
I honestly believe it's both, but I can't say on the medical or the scientific side. I can only see my experience in me coming out about my illness and things like that, and connecting with a lot of other people in the sarcoidosis community. Our bodies are just different. Everybody's body is different, of course, but sometimes your genetic makeup can kind of, push along further because, African Americans are, at higher risk for other illnesses as well. It could be an economic status. It could be environmental status. It could be anything, but it's just one of those things that you're kind of baffled about. We need the research. And I try to get as many African Americans and people of minority descent to join the registry so we can get the research opportunities that, we're looking for. And, so we can get the data on paper and, to find out why we're highly affected the way we are. And so that's part of what this campaign is going to do. Is going to put us in a position to where we can put our African American men and women in a position to get the answers that we're looking for, that we ask ourselves sitting at the kitchen table every day. Why is this happening the way that it's happening?
Yeah. So you guys feel like when you go in and you sit down with the doctor, you had 15 women in this group and you had the commonality of not being listened to. So therefore, slow diagnosis or undiagnosis.
Yes. One of the common things with the group of women is that a lot of us were diagnosed. It took a while. It took a while for a lot of us to be diagnosed because someone may have been diagnosed with cancer. Someone else may have been diagnosed with lupus first because they're so common. And it was probably easier to diagnose the lupus than it was to diagnose the sarcoidosis and stuff like that. But, just for my own personal story, when I was first diagnosed, they found it in my kidneys, which really wasn't common at all. If you know anything about sarcoidosis of the skin or sarcoidosis in the lungs was more common than anything else. And when they found it in my kidneys, we were kind of baffled. So my nephrologist, he referred me to a rheumatologist. This rheumatologist did absolutely nothing for me but prescribed me medicine, and that was it. I can't remember a time when they ever pulled out a stethoscope or they ever pulled out anything to do any type of body exams or anything of that sort. So it's me telling you how I was feeling, me telling you what was going on, me telling you my symptoms, me telling you this, me telling you that, and you're just not listening. Ignored everything that I had to say. So it was just one of those things like, okay, now this is not working for me. So what did the charismatic Chasta say? Oh, you're about to get fired. And that's exactly what I did. I fired my rheumatologist and I found a new one.
Yeah. Makes you feel any better. I did too.
Okay. Yeah, it made me feel a whole lot better.
Yeah. Okay. Dr. James is with us. Here we are, and we're chatting along. We just sort of introduced it, and we're just going to bring you right into the conversation. But we have just been talking about the terrible statistical situation for women of color with sarcoidosis. And Chasta's been talking a little bit about how her group feels like they've been treated by, sort of disregarded by medical science when they come in as patients. And I'm sure that's not a new thought to you. But what I want to do is ask you, if you would, is there something we Shasta and I can only suppose that it's something that's genetically related, DNA related or whatever. Is there a clinical reason why women of color are so impacted by sarcoidosis compared to other groups?
So I agree with you, with the genetic predisposition. I think one of the things specific to South Carolina, at least, that I think demonstrates that is they did do one study looking at hospitalization rates in the upstate, which is the Greenville area, Midlands, around Columbia and the Low Country, and looked at hospitalization rates in white and black sarcoid patients in those areas. And in the Low Country, there was a significantly higher rate of hospitalizations in Black patients compared to other regions that couldn't be explained just by differences in, population. And so the theory being that, maybe there is something in the environment down here, whether it's some, environmental bacteria associated with, the salty, humid environment, that Black patients may be more likely to respond to and cause sarcoidosis. Another good example of sort of that genetic environment interaction is the Gullah population, which is one of the few sort of, I guess you could call it, genetically isolated Black populations in the U.S. Who come from Sierra Leone and Africa. In Sierra Leone, lupus does not exist. But in the Gullah population in South Carolina, the prevalence of lupus is astronomically higher than the rest of the country. So again, sort of thinking that there is something in the environment that they may be genetically predisposed to that's causing them to, their immune systems to behave differently. Clinically, the patients that I see who come in with really bad scarring in the lungs, a lot of them, to be honest, have not probably had the health care to that point that they should have received for various reasons. I think, and again, I think we should be taking full blame for this, but it's, they, in general, I think a lot of times Black patients have less of a trust for the healthcare world because it's, historically has been a predominantly white male, world where we haven't done a good job of actually taking care of patients the way we should. And they also, in general, though, if you look at our clinic population specifically, for example, the no-show rates. So when patients have, appointments scheduled and they just don't show up, we actually have started calculating that data and looking at who that population is. And it's middle to young age Black women. And what we've now started doing is actually...
There are no shows.
Right. So they just don't show up to clinic. And so, historically, and this is kind of gets to that bias you guys are talking about, historically, when I first got here, the solution to that problem was to overbook. So all the healthcare system is worried about is actually being sure those appointment spots are filled, not actually reaching out to those patients and saying, hey, why couldn't you come? What can we do to help you? And so when we've started reaching out to those patients to see what the issue is, transportation is a big one. So they may not have a car, they've got one friend with a car, and if something changes and they can't take them to their appointment anymore, they're out of luck, or they got, childcare issues, or they're working 3 jobs and they just, either slept through the appointment because they've only gotten 2 hours of sleep in the last 24 hours, or, couldn't get out of their job. And so, I think there's a lot of things where, the focus again of sort of the healthcare world has not been to accommodate those patients and try to do everything we can to enable them to get the kind of care they need. Because a lot of times I'll see patients who at their first visit, they've got active sarcoidosis in their lungs. Their CT scan shows some inflammation, but not much in the way of scarring. They're usually younger, early 30s, Black patients. And then they get lost to follow-up for 2 years. And the next time I see them, it's in the hospital because they've been coughing up blood, and now they've got just terrible scarring because they haven't, been on treatment, and the inflammation has kind of run wild, so to speak, in their lungs. And those are just heartbreaking situations because that's something where we really could have intervened earlier and prevented that. And
right. Let me jump in here because I want to get Chasta to react to that. Chasta, is all that ringing true to you?
It sounds very familiar.
Really?
It sounds very familiar. And in my situation, I was diagnosed at the age of 18. Right before my 19th birthday back in 2005. And, I never had the pleasure of working 3 jobs and having to take care of children and stuff like that. But I did have the notion of when the sarcoidosis started to affect my eyes, I felt like I became a burden because I couldn't drive myself to places and stuff like that. So I had to rely on other transportation. And if I couldn't get my mom to get off work, or my brother was busy, or my aunt couldn't do it, then I was just stuck in, for lack of better terms, I was stuck like Chuck. So, it was just, it sounds very, 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 very familiar. I've been blessed with a team of doctors though. My nephrologist was Indian. And so he took amazing care of me before he decided to get out of that particular field and started to pursue other areas of science, of medicine and stuff like that. So every other doctor besides the few that I've fired have been of minority descent. And so they kind of knew, I'm not going to say they automatically knew that I got to give her a little special attention because she's an African-American woman. But being 18, I didn't ask for this. I thought I was doing everything possible starting at the age of 17. I was a high school athlete. I was a scholar. I was on my way to college, right. So I didn't ask for this. So I really had no reason to be treated like I was an infection.
Yeah, and you're blind in one eye now. Yes. Because of sarcoidosis.
Yes.
And where else do you have it in your body? Where are the manifestations?
Dr. James, where else? I have it everywhere, but I think the only thing that's not really affected is my neural system.
Yeah.
I don't have a lot of activity with my liver at all.
You got it in your lungs and your eyes mainly in terms of where
it's mainly the lungs and the eyes. Those are the main places that we're treating now. But like I said earlier, when they originally found it, they found it in my kidneys, which was a little weird. Right. But we made it through all of that.
And I should point out that Dr. James is your doctor.
Yes, he's mine.
Right.
I haven't been fired yet.
No, he hasn't been fired yet.
Well, be careful. So Dr. James, let me get back to this because when I looked at these statistics that I just shared with the listeners, African-American women 10 times higher than Caucasian women and more than double that of African-American men in terms of hospitalization rates. I mean, some of these are off the chart anomalies statistically. Is this group of people just not being listened to, or what's going on?
I think it's a combination of things. I think, like we talked about earlier, the healthcare access isn't what it should be, but I also think they just are more likely to have more severe disease, which, we know based on historical studies in sarcoidosis that, the likelihood that they have multiple organ involvement is higher. The likelihood that they have more severe lung disease and fibrosis is higher. And, the other bias, I guess I would say is, similar to what Chasta alluded to earlier is 10, 20 years ago, patients would come in and it wasn't, I feel like we didn't really do a great job of managing sarcoidosis in general, on the whole, obviously with a few exceptions out there, but doing things like, looking for dangerous organ involvement and the idea of seeing a patient with scarring in their lungs and just automatically calling that patient as burnt out sarcoid and not having active inflammation that could benefit from treatment We've gotten a lot better at that recently, and studies from Europe, for example, showing that actually 75% of those patients with scarring have associated inflammation and can have improvement in their symptoms if you actually treat them. And so, I think it's a combination of things ultimately, but all things I think that we can do a job of addressing. And a lot of it has to do with awareness. And it's not only awareness on the patient's part, but also on the physician's side of things. I mean, that's from my standpoint, one of our biggest missions is to try to do everything we can to have every provider be aware of dangerous organ screening, of, when to treat somebody with sarcoidosis, when to not treat them, and obviously avoid all the side effects of prednisone. So there's still a lot to be done, but I think it's all surmountable.
So that's my question is, Chasta, what would you like to see, and what would the Women of Color Committee like to see? I know you've had some meetings. What would you like to see happen right away?
Education.
As patients.
Education, people getting educated. One of the things that we released on yesterday was, the Ask, Engage, Connect, so that you can be informed about what's going on, not only with our campaign, but what's going on in our community. We really want providers to listen to us. We want our community and our families to understand, and not necessarily just understand, but to not blow us off, just like our providers are doing as well. And because it's hard. Sarcoidosis is one of those diseases that nobody really knows. So we are the voice of sarcoidosis. We're the faces of sarcoidosis. We're the voices of sarcoidosis, and everything that we're saying is experience. So statistics at that point go out the window. This is the experience that we're having. This is what it's doing to my body. And if you just take the time to listen, get educated, donate to research opportunities, go to the doctor with me, listen to what the doctor says. If you got a question for the doctor, listen, my mom will ask Dr. James any question out there. She asks sometimes more questions than I do. The last visit we had, my aunt went with us. She was asking questions. So ask questions, be involved, get engaged in the community, so that we can get not only sarcoidosis possibly cured before I die, but I really want to see us move forward with the research. I really want to see us move forward with the engagement from our community, from our friends and our family. And I really, really, really would love to see the understanding from more providers.
Does she make good comments there?
100%. Yeah. And it's, and I really want to actually reemphasize two things that she mentioned. One is research. So, and again, largely a failure on our side of things, where we have not done a good job of recruiting patients into studies with the worst disease. I mean, if you look at the larger funded trials historically in sarcoid, most of them are 70 to 80% white patients. With median incomes, well above the poverty level, which if you look at my clinic population, that's, the people who have bad disease, that's not the people who are included in these studies. And the other thing is sort of the psychology, I should say, of sarcoidosis, because it is really frustrating for patients when you've got this disease. You can look normal on the outside, but you've got profound fatigue, you're short of breath, you're having trouble seeing, and having that conversation with family and friends, and even some physicians, it's really hard for them to convey how they're actually feeling, and then have other people actually believe them, because again, they look normal on the outside. And there's even things like, the patient guilt. I had a patient this week already talk to me about how he really struggles because, he wants to take his wife on trips and, show her how much he appreciates her, but he has this profound guilt because she's stuck taking care of him on oxygen at home all day and having to drive him back and forth to visits and things like that. So I think, having family members who are really engaged, like Chasta's family is, having those sort of advocates around you can make a huge difference in how people do, not only just, having a support system, but asking those questions that you may not have thought of, so I think educating everybody would make a huge difference down the road.
Yeah. So as we go forward here, and that's Chasta, your group is made up of patients and caregivers as well. Is that correct?
Yes, we have patients. Everybody is a patient except for one young lady. She's a caregiver. And we also have a couple of healthcare providers, as far as nurses is concerned, that are on the team as well. So.
All right. And so when you guys get together and you talk about the commonality that you're seeing, which is difficulty in being diagnosed and then difficulty in being listened to and so forth, how do you raise the flag? How do you get the word out there to the rest of the world that this is going on? And how do 15 of you make a difference?
Well, what we're doing now, joining a committee that FSR has put together. But like I tell a lot of people, my advocacy work started the first day I was diagnosed because I knew absolutely nothing about sarcoidosis. I never knew it existed until January the 5th, and I got that phone call and my doctor said, this is what it is. So I began to advocate for myself. I advocated for myself. He gave me information that was needed to get me over the hump and tell me what it was. He laid the groundwork for me and I just picked it up and started running. So I've been doing my own advocacy work since January the 5th, 2005. And then I found and connected with other people who were doing a whole lot more than what I was doing. And I sat down and I listened. I listened to what their stories were. I listened to how they were getting information out. And when social media just began to boom, I said, hey, let me go ahead and run with it. I was nervous at first. I didn't want to put my life on social media because I felt like I was putting too much of my business out there. But this particular business can help somebody else. So I took it and I ran with it. You can find me on all major social platforms, and I'm always talking about sarcoidosis somewhere. So until people really take heed to what you're doing socially, you need to open your mouth, say something.
I got that. But you're one person and then you've got 14 other people. So, Dr. James, how do we get the medical community all across the United States and around the world to listen, and how can the Foundation for Sarcoidosis Research help make an impact so that doctors know what you have figured out with some of these studies about, the no-shows and people not being listened to, and the likelihood that it is active sarcoidosis as opposed to burned out sarcoidosis? How do we get the whole medical community to start looking at this?
So I would say two big things: noise and resources. So the noise is just what Chasta is alluding to, where there's just more people putting their stories out there. And for example, one of the impacts that could have, which would be significant, is in South Carolina, at least, sarcoidosis is not on the list of diseases for which you can get disability for, which makes applying for disability and Medicare and Medicaid for a lot of patients extremely difficult, which, prevents them from having the resources they need for care. So with resources, it's not only educational resources, I think, both for physicians and for patients, but it's actually trying to come up with some tools that we can put in people's hands. And so one of the things that we're working on right now is actually trying to make another smartphone app that patients, regardless of whether or not they've been seen at MUSC, can download it, answer questions about their sarcoid, and it'll tell them what dangerous organ screening testing they may need. And then they can take that either to their physician or they can do a video visit with us here at MUSC. And that's something that, you may have a rural patient who sees a rural family medicine doctor not familiar with sarcoid, and they come in and say, hey, I got this app. It says I need an EKG and an echo. And that physician, it would then be a learning opportunity for that physician to be like, what on earth is this? Why would we ever need to do that for sarcoid? And so, I think things like that would make a big difference, because it's truly not only a resource that can be educational, but also a tool to actually ensure patients are getting the care they need.
So if an African American woman shows up with her smartphone and an app in, I'm just going to pick some hinterlands place, North Dakota, and says, "Hey, look, I need this." Come on, that doctor's not going to listen to that person. It's just because doctors hate it when patients have been on the internet before they come and see them and have already self-diagnosed. I mean, all doctors hate that no matter what it is. So if you show up with an app that says, "Look, I have sarcoidosis," is it going to work?
So I think two things would help it work. One would be having the app be created and made and promoted by a credible sarcoidosis center with some legitimacy, as opposed to just somebody who just creates this thing out of the blue. And the other thing is the advocacy piece. And so, Chasta has said this multiple times where, when we give people this tool, if their physician blows them off, we need to also enable them to advocate for themselves and give them other avenues of, who do you get in touch with if you get blown off by your physician? How do you find patients around you to figure out who others may be seeing that are more familiar with sarcoidosis locally? So I agree with you. There may be some people who they're not too happy when they've all of a sudden got to order some additional testing to follow up on. But again, if even only 3 out of 10 patients, they actually get the testing they need, that, in my opinion, is still a good thing.
When I was diagnosed with sarcoidosis, one of the people, and I was kind of in a haze coming out of surgery because I'd had this major surgery on my neck because they thought that I had a tumor, only to find out that it was sarcoidosis when they got in there. But I remember somebody looking at me and saying, "You really shouldn't have sarcoidosis because you're not African American and you're not an African American female." And I thought, okay, I didn't know what to do with that information. I didn't know how to process it. But is it more, are African Americans just more predisposed to have sarcoidosis? Is that true?
Yes. And this is a very common misconception. And one of the first things that I teach the fellows in training here is, I actually ask them, all right, in the world, do whites or blacks have more sarcoidosis? The answer is whites. In the US, is it more common in whites or black people? And the clarification on that is, are there more total number of white sarcoid patients than black patients? And the answer to that is yes. In the US, there's more white people with sarcoid than black people. But if you take 100 white patients and 100 black patients, the prevalence of sarcoidosis is going to be much higher in the black population than the white population. So they are more predisposed to getting it. And that bias you mentioned, John, is still wildly prevalent today. I've seen, young white women, for example, who went 2 years with what I would consider an extremely common presentation for sarcoidosis, who were told over and over again, well, gosh, your biopsy shows granulomas, but you can't have sarcoid, you're not black. And so, again, the education piece on the part of physicians, I think, is really important for the success of all this. So having empowered patients, but also having, knowledgeable physicians is important.
But it also brings home the stance that while we're here, African-American women are not speaking out because we don't feel like we will be heard. So while you see the numbers of more white women here or more white women there or more white patients here, it's simply because the Black delegation we're not speaking out because we don't always feel like we're heard. We went to the doctor because we had stumped toe and come to find out, or a sprained ankle, but come to find out 2 months down the road after we've been in a boot that it was actually broken because you didn't take the time to do the x-ray, to do the scans and all that kind of stuff. You just threw something on it. You threw a Band-Aid on it and you sent us on our way. And we've been walking around doing more damage to the broken ankle simply because the doctor didn't do what the doctor was supposed to do. So we're not speaking out. I can't tell you how many times I've heard, well, maybe, my doctor just doesn't listen to me. I'm not speaking out about it because nobody cares anyway. I've heard that so many times just within the social circle, that we're not going to be heard. So that's why the numbers are the way they are, because African American women or women of color don't feel like we'll be heard.
And I think just to add to that, Chasta, I think that can go both ways, not only in not necessarily advocating for themselves specifically when they know they have sarcoid, but the patients who come in who may have an x-ray finding that might be consistent with sarcoidosis, and the physician automatically says, oh, you probably got sarcoid, we don't need to do any other testing. I mean, I've seen multiple patients who I've actually diagnosed, again, years later with cancer, who were in and out of ERs getting prednisone, being told they had sarcoidosis, and come to find out if they had just had more testing or it said, like, hey, this doesn't seem right. Like, I keep having these symptoms. I'm in and out of the ER. Like, how do I get more testing to really figure out what this is? Being able to advocate for themselves would hopefully help, prevent people from being misdiagnosed with sarcoidosis.
Yep.
Well, it seems like what I'm hearing then is you got a group that's predisposed to have sarcoidosis, who it feels like they're not listened to, and but also has a hard time getting to the doctor. But we look at these statistics, and we have a mortality rate that's 13 times higher than that of Caucasians, but 1.5 times higher than African American men. Are African American men more listened to by physicians?
I'll let Chasta answer that question. I don't know.
No, it's the same.
So. Yeah.
It's the same for men. It's the same for African American men. So if you're Black, people don't listen to you.
Right.
The doctors don't listen to you.
Right. And it's not just necessarily Black. It's just anybody of the minority descent.
Minority descent. Okay, that's fair. So, Dr. James, is there some educating that we need to do with the medical community?
Absolutely. And I think there's a lot of underlying biases there that may actually, in my opinion, make the mortality rate that's been reported in African American men lower than it truly is, because we know men are less likely to seek health care than women. And so it may be that it's actually higher. And like Chasta said, it doesn't matter if you're a man or a woman, when you come in and have all these non-specific complaints and you look normal on the outside, physicians are much more likely to just blow you off and not necessarily, say, hey, maybe we should do some more testing to look into this. And so I think the idea of, when you have a sarcoid patient, they may look normal on the outside, but they may feel terrible. And there may truly be some life-threatening underlying organ involvement that needs to be looked for. And without evaluating for that, you can't blow them off, until you've done your job, in my opinion, to actually rule that out and be sure there's nothing that's actually truly dangerous that needs to be treated. It's malpractice to not continue to investigate and do your job as a physician.
So we've got about 10 minutes left here. I just want to hear from each of you. So the Foundation for Sarcoidosis Research has launched this committee. They're going to be doing some stuff with social media. You're here on the podcast, and hopefully the podcast will help advance the conversation. And you've got sponsorship from Mallinckrodt Pharmaceuticals and Global Genes. So there is a little bit of money behind this. Can it make a difference, Dr. James?
Absolutely. I think the power in making changes in the healthcare world really lies with the patients, and, empowering patients, in my personal experience and personal opinion, I think that has a huge impact. Just think about Bernie Mac, God rest his soul. If he hadn't passed away, there wouldn't really be, anybody out there for patients to say, oh, this is what Bernie Mac died of. Maybe I need to actually take this seriously. And so I think empowering physicians is super important. And through that, I think we'll be able to hopefully educate more physicians as well, in addition to patients. but I do think it's going to be successful. I think it's going to require some work, and I think we're going to have to make some noise and really change the research landscape. But I think definitely with patients like Chasta involved, it can happen.
Chasta, what do you think?
Absolutely. And I was gonna, say what Dr. James said, just say it a different way. It's not the sole responsibility of our doctors to advocate for us all the time. We have to absolutely put in work for ourselves to make sure that we're heard, to make sure that we're communicating, because Dr. James and I just did a seminar on bridging the gap between the patient and provider relationship. And it's very important that, the patient and the provider have a working communication relationship that allows you to actually be heard by your provider. And I think it's very, very, very important that the bedside, in the words of my grandmother, God rest her soul, bedside manners from a doctor are always exuded. And, and I'm not saying you have to be forceful. I'm very playful when I go see Dr. James. I'm very charismatic. That's just my personality. And we always we're laughing majority of the time. And the only time we don't laugh is when I don't feel good. So thank God we haven't had a lot of those visits and stuff like that. But, and you have to make it, make it what it is, put your personality into it. And so Dr. James is a wonderful physician, but Dr. James is also a wonderful person because I know his personality. So, it's just not the sole, responsibility for the doctor to do all the work. As a patient, you have to do the work as well.
All right. And now you've got your group, you've got 15 women, and you've got some money behind you and the power of the Foundation for Sarcoidosis Research. So hopefully the tentacles of all of that, you'll take that nucleus and you'll just push it out. And you've got women from 11 different states and with various manifestations, 11 manifestations of sarcoidosis, which means different places in their body. And so hopefully that'll all work. And Dr. James, you've got your group there at the Medical University of South Carolina. And hopefully you guys will reach out to your colleagues and people will just become more aware, right?
Exactly.
At the end of the day, it's about awareness.
Yep. It takes a village.
All right.
Yep.
Well, guys, thank you for joining me here on the podcast today.
Thank you, John.
Thank you.
I feel like a zombie, just feeding and stumbling.
Okay, women of color and your supporters, it's time to get active. So I'll tell you right now, if you're listening on October 25th, 2021, today is the day that there's a Twitter chat on the topic. It's sponsored by Mallinckrodt Pharmaceuticals and Global Genes. It's from 11 a.m. to 12 p.m. Central Time. Two doctors who are a part of that clinical advisory committee will be answering questions about sarcoidosis. To join the chat, users should follow the @StopSarcoidosis group on Twitter, that's FSR, and then post using the hashtags #sarcoidosis, #IgnoreNoMore, #AAWS, and #WOC. And then I want to tell you that coming up in February of 2022, which is not too far off, it's Black History Month, and FSR will be launching a month-long social media campaign providing an easy-to-use social media toolkit and also educational resources to help raise awareness. The educational webinar will be held in February of 2022, and we also want to let you know that there is an infographic providing detailed information on the prevalence of sarcoidosis in African American women, and that is already available on FSR's webpage, and it is dedicated to the AAWS campaign, African American Women with Sarcoidosis campaign. In the meantime, of course, the women are meeting and they're coming up with new plans to raise awareness about the issues that we've talked about here on the podcast. And of course, FSR is working to create other opportunities to let their voices be heard, to magnify those voices, and hopefully make an impact. I do want to bring your attention to a previous episode of the Sarc Fighter podcast, which was an interview with ATIRE's president and CEO, Sanjay Shukla, because ATIRE may be on the verge of a breakthrough for a new Sarc medication which could affect African American women and everybody else, primarily pulmonary patients as far as they know, but it would be the first medication pointed straight at sarcoidosis. So if you're looking for a really good back episode, check that out, and I'll put that in the show notes as well, because in the next year or 18 months, we will be hearing about what may be a breakthrough in fighting sarcoidosis. Remember, the official Sarc Fighter song is called Zombie by Mark Steyer and his band, the White Hot Lizards from Alberta, Canada. Mark is a fellow Sarc fighter, a hockey player. Couldn't play anymore because of sarcoidosis, but also an amazing musician. So listen to the song and go back and listen to his story if you like. I think you'll enjoy it. I call this the Sarc Fighter podcast because I have sarcoidosis. And if you're in this space, whether you're a caregiver, a patient, or a researcher, this is a place we can gather, because so many Sarc fighters feel like they're all alone. And I do want to let you know that there is a reason for hope, that people are doing things, and that there is a robust fight against sarcoidosis. And we've heard all about that here today. And as always, I need to tell you that my trusty dog, Dougal, my boxer, who we rescued from the local SPCA, is curled up on the chair right in front of me. And Dougal is one of the things that makes my life so much better. That's a good boy, Dougal. He's not even looking at me. Please don't forget to go back and listen to the bonus episodes on sarcoidosis and COVID-19, and another bonus episode on how to deal with prednisone, which is the frontline defense for sarcoidosis. But prednisone itself can make our lives unpleasant. And we had rare opportunities when FSR put some of the top experts all together in patients, and we could talk about what was going on from the patient perspective and what doctors think about it and what researchers think about it. And what one researcher said about prednisone was that it should never be allowed to be a drug. It is poison, and it never would get through the process if somebody was trying to introduce prednisone into the medical world today. It would not pass muster. So, but you may very well be listening to this and taking prednisone, and you might want to hear that. If you're new here and you're just trying to figure out what Sarc is, try listening to episode 1 with Dr. Simon Hart, actually episode 2 with Dr. Simon Hart. That is one of the most listened to episodes. If you want to know my story, listen to episode 1, give you my whole sorry backstory of fighting sarcoidosis. Please send me an email. It's in the show notes, carlinagency@gmail.com. If you like the podcast, if you have some thoughts, maybe you'd like to appear as a guest, please let me know. Follow the Sarc Fighter on Instagram and on Facebook. And I really just appreciate your interest in the Sarc Fighter podcast. I enjoy the feedback and just enjoy knowing that we're making a little bit of an impact here. This helps me reach more people and grow the show. If you would share it on your social media, just grab the link and put it on your Facebook page or on your, you can't put a link on your Instagram account, but talk about it on Instagram if you like. And if you'd like it, just tell one person. Give the show a nice review on wherever you listen to your podcasts. And thanks again to Chasta and Dr. James for joining me here. Good luck with launching the committee for the women of color, and let's hope that you guys make a lot of noise and somebody hears it and we can make these statistics settle down just a little bit. All right, until next time, keep fighting.
Learn to suffer, you feel pain someday. Learn endurance, your strength will fade away. Dead man walking, trying to keep up the pace. Dead man walking, counting